How to use best online health insurance providers properly. Beginner mistakes that cost you. Online health insurance providers make finding coverage convenient, but beginners often make mistakes that cost money or leave them underinsured. You won't believe how often people choose poorly just because a plan is advertised as best. The first mistake is relying only on premium price. Low monthly rates can hide high deductibles, limited coverage, or poor prescription support. Always consider the total cost of care. Another common error is ignoring provider networks. Even top online providers may have limited networks. Check that your preferred doctors, hospitals, and specialists are included to avoid expensive out-of-network charges. Many people also overlook plan benefits. Preventive care, mental health services, maternity coverage, and telehealth options can vary widely. Not reviewing these details can result in inadequate coverage when you need it most. A surprising mistake is skipping customer support research. Online providers may be convenient, but slow or unhelpful claims processing can be frustrating. Check reviews for responsiveness and support quality. Finally, beginners often neglect to review plans yearly. Health changes, new medications, and plan updates can impact both cost and coverage. Reviewing annually ensures you stay protected and get the best value. To properly use the best online health insurance providers, focus on total costs, verify networks, evaluate benefits, research support, and review annually. Doing this avoids surprises and ensures you have reliable, affordable coverage.